Right, so we've had several organizations donate their stock of medical masks, medical grade masks. And I was told by the foundation this morning that we had received approximately 4,700 medical grade
Wow.
masks. And then an additional
Oh,
2,260 N95 masks
okay.
and 60 handmade masks. We've also received disposable aprons, overalls, wipes, gloves. And up at the command center yesterday, when I was working it, somebody donated 100 pizzas, which we delivered to staff and different areas of the hospital.
Right.
So, what should they do if they have a donation?
Well, first, I just want to, with all my heart, thank the community for just the outpouring of support that we've received. It has just been amazing. And I mean, you talk about the humanity, the spirit of this community, which doesn't surprise me. You know, when in times of great difficulty, our community always seems to come together and help one another. So, and I know particularly healthcare workers are on the minds of many people, and just the emails, the letters, the flowers. Almost every single day, we have an individual in the community or a business that's buying lunch for the staff, you know, working in the ED or the lab or up on 2 South, just to express their appreciation. A very good friend of mine, I'll give a shout out to her, Kathy Singh, owns Kathy's Kernels. You may see her stuff out there in the markets, the caramel corn laced with chocolate or peppermint, but she makes these amazing Rice Krispie treats. And every single day this week, she's delivered about 70 of them to my house every single night to just hand out to all of our staff. And they are incredible. And she intends to keep making them and making them. And she says, I wanted to do something, you know, for our community and for our hospital. And so, yeah, thank you to everybody that has donated personal protective equipment. It is really important. So, you know, it's a balance. I want, you know, there was a lot of information that was going out there over this weekend that people were hearing that Cahuilla Delta had completely run out of masks and gowns and everything, and that our employees and our providers were now completely at risk and unprotected. And like in any situation, you know, those rumors do happen and they spread quickly. And I want to assure you that that is not the case. We do have personal protective equipment. In the command center there yesterday, we reported that under normal circumstances, normal usage, we have about 30 days worth of N95 masks, surgical masks, gowns, and so forth. But in a situation like that, that's a very low supply. And if we experience any kind of surge, we could quickly run out. We are trying to preserve as much as we can because the availability of it is really beyond our control. We have to look to the county and the state and the federal government. We're ordering new supplies every single day. Shipments are coming in, not to the extent that we are ordering, though. They're partially filling a lot of our orders. And we could quickly burn through them. But we're not at a critical stage, but we are asking our staff. We've implemented a very explicit protocol that, you know, talks about if you're in surgery, if you're on 2 South, you know, the respiratory unit, if you are a direct patient caregiver, if you're going into an isolation room, you know, so there are very specific conditions where you would wear PPE and the type of PPE you would wear, whether you're wearing an N95 mask or a surgical mask, whether you have to have a shield or, you know, a gown and gloves and things like that. So we do have supplies, but again, it's not an abundance of supplies. So everything that the community has been providing, we greatly, greatly appreciate it. It actually obviously extends our own internal ability to provide PPE to staff. And then the homemade masks, that's just incredible. I first heard about it at Deaconess Hospital. Their community had wanted to do something for their community and do something for their hospital. And I'm so grateful that community members have reached out to us and are making masks. And we actually have a meeting at 2 o'clock this afternoon, right before our daily 3 o'clock command center meeting. We have a committee that is dedicated just to masks or PPE. And so they're now adjusting the protocol so that we incorporate the community-made, the homemade masks into that. So again, incredibly grateful to the community for all their support.